right, welcome back. September is Prostate Cancer Awareness Month, and according to the American Cancer Society, prostate cancer is the second leading cause of cancer death in American men. Joining me from the Palm Beach County Health Network is Dr. Joshua Jew. Thank you so much, doctor, for being with us. I was telling people in here, this is very personal to me. I lost my grandfather to prostate cancer, and so I always think of it as being something that's so preventable.
Right.
And so that's what I want to talk about today, a little bit about how this cancer is detected, how it's treated, and how we can catch it early.
Of course. Well, I'm sorry to hear about your grandfather.
Yeah, it was tough.
So like you said, prostate cancer is the second most common cause of cancer death in American men. Approximately 1 in 8 men will be diagnosed with prostate cancer during their lifetime. However, about 1 in 45 men will die from prostate cancer. Prostate cancer is usually detected by an elevated PSA level.
And what age should men say to their doctor, even though their doctor should, suggest this, but they should make sure that they're getting that PSA test?
There's been some controversy about the value of PSA screening in the past. However, most urologists agree that PSA screening should begin at age 40 for men at high risk for developing prostate cancer and age 45 for men at an average risk of developing prostate cancer. MRI is also commonly used now in the workup of an elevated PSA level.
And so if detected early, is it a pretty easy cancer to treat?
That depends on the grade and stage of the prostate cancer. So the grade is how aggressive the tumor biology is, and the stage is how much the cancer is spread at the time of diagnosis. Luckily, most men will die with their prostate cancer, meaning they get to enjoy their good quality of life, everyday activities, rather than die from prostate cancer. That being said, it's very important to accurately diagnose the prostate cancer so that the appropriate treatments can be offered. Undertreatment will not appropriately cure the patient of prostate cancer, while overtreatment will expose the patient to unnecessary side effects.
Okay, so let's say that maybe you're 42 and all of a sudden you're like, oh, I haven't had that screening, but what would be perhaps a red flag or something that you may notice as a male that, yeah, maybe I need to get this checked?
Of course. Well, I think that really depends on their risk. So high risk would be considered a very strong family history of prostate cancer or lethal prostate cancer in the family. African Americans also fall into that high risk category, germline mutations. So there are different things that the patients can know about themselves who should be checked. But like I said, those different age groups before, most men should be screened at some age level for.
But are there signs and symptoms at home that you might notice before?
Unfortunately not.
Okay.
So that's really where the exam by your physician and hopefully a urologic surgeon comes into play, as well as that PSA screening test, which is a blood test.
All right, well, us women have to do lots of screenings and tests all through, so that's just the least you can do for us women out there. But at the end of the day, a lot of times it's an awkward conversation. And a lot of times men neglect their health care. And so how do we start that conversation? What do we need to say to our husbands, our brothers, our fathers about making sure they're doing this?
So like you said, women have an OBGYN that they regularly see for women's health. I think men should generally have a urologist that they see for men's health, especially when they're age 40, 45. They can come on in and have their prostate screening, as well as we can discuss urination issues, erectile dysfunction issues, kidney stone prevention. There's a whole host of things that men and women can regularly see a urologist for just general health.
All right. Well, good information. Thank you so much. Like I said, us women have to do it all the time, once a year at least. So it's the least you can do. So thank you. Good information. We appreciate it. If you would like to know more information about this and perhaps help the men in your life, go to our website, WPBF.com, and you can search Prostate Cancer Awareness Month. It's going to take you to a website with a plethora of information, Sandra.